First of all, thank you so much for your kind words. I'm very excited to be speaking with you today. Yes, it's very true. That was an amazing honor to be the recipient of the 39 Camillo Golgi Award for work in diabetes complications and comorbidities. This is a work I have done my entire career, and it has been driven by my passion to help people with diabetes have a better life. It was also quite remarkable that I was given the award of one of the parents of understanding the structure of the nervous system as well as some of its physiology, given that many of the complications that I have worked on are so linked to the nervous system, the peripheral and the autonomic nervous system being focus of my work and research. Yes, it was very exciting, very honored, and I'm very grateful to the committee and to the European Association for the Study of Diabetes for recognizing my work. Yes, actually, this is a great question. Understanding the earlier changes in the function of the autonomic nervous system that controls both the cardiac and the vascular function, it's important because as now we and others have demonstrated, these earlier changes do have important prognostic implications for cardiovascular disease, chronic kidney disease. The fact that the technology has advanced, that now these indices of heart rate variability could be in fact presented in an EKG report, like we show the PR interval or the QTI, it's also relevant. And we had the opportunity to actually test the validity of these indices in truly identifying cardiovascular autonomic dysfunction. This is important because performing a 10-second ECG is very easy. It's part of the care of many patients, and therefore these indices could be used as a prognostic indicator for clinicians who see patients on their daily practice and use them in guiding additional management steps. So we have identified important risk factors for various complications. We have identified that the spectrum of risk factors, it's not the same for one versus other complications. We have also identified that for people with type 1 diabetes, still intensive glucose control remains one of the most important strategy to prevent complications during the life course, including less traditional complications such as sexual dysfunction, bone disease, function, and also cognition. I think that that's very important in addition to the kidney and the cardiovascular complications. We have identified inflammatory pathways that now can be targeted with new agents. We have also identified screening strategies now that are effective with biomarkers that can be also implemented at the point of care to see which patients have the highest risk of developing severe heart failure, especially since now we have intervention that can reduce that risk and then can be given much earlier in the course of the disease. And we are now working to try to find the best biomarker to predict wound healing in people with diabetic foot ulcers, knowing that foot ulcers due to neuropathy are the leading cause of amputations in people with diabetes. And when a person has an amputation, their mortality rates increases exponentially at the same rate as cancer. So those are just few. Well, EISD have been always very well organized. I have been coming to the EISD for many, many years. I go both to the American Diabetes meeting and the EISD. Yes, it's a great organization. I think that now people are much more comfortable to coming to this meeting. You know, after the pandemic, things were starting slowly. I have to tell you that before the pandemic, both the EISD and ADA had more than 17,000 participants. So we are now slowly coming back to that. And that's actually amazing to see that people are comfortable to come and meet and interact and bond, because that's another huge way of learning new things and also getting new ideas and creating new friendships and collaborations. Thank you so much for interviewing me.